Hello and welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in Atlanta, Georgia, May 17th through 19th, 2013, and who are brought to you by One Concept. I'd like to take this opportunity to thank the 2013 American Massage and Chiropractic Conference sponsors, Massage Warehouse Script, MPA Media, the Chiropractic Leadership Alliance, Mindfluence, ABMP, BioFreeze, and Massage Envy Careers for making this year's event possible. Our special guest today is David Kent. David and I will be talking about his 3 classes, a 1-hour class entitled The ABCs of Meeting with Physicians, a 3-hour class entitled Breaking the Cycle of Head, Neck, and Back Pain, and, of course, David's contribution to Student Day Systems for Success. But first, let me tell you a little about David. David Kent is the president and founder of Kent Health Systems. He has developed a line of products to assess, educate, and document the myofascial causes of pain. David's systems are used throughout the world by hospitals, medical, dental, chiropractic, and physical therapy clinics, and professional sports teams. The Kent Health System includes the postural analysis grid chart, trigger point charts, muscle movement and joint range of motion chart, essential office forms, and a series of DVD programs that teach anatomy with un-embalmed human dissection followed by manual therapy techniques. David opened his own clinic in 1992 and continues to treat patients. He teaches full-body gross anatomy dissection seminars at the University of South Florida College of Medicine in Tampa, Florida. David also teaches manual therapy and practice-building seminars. He is a regular contributor for numerous trade journals on topics including dissection, postural analysis, trigger points, manual therapy, and practice building. David, welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. Thanks so much for making time to talk with me about the event and your classes.
Hey, Felicia, thank you for having me. I'm excited to be here. It's great working with the One Concept team. That whole group is awesome. I've been working with Scott back into the early 90s, actually. He had brought me up to Canada back in the early 90s. And I want to thank all our sponsors. I'm looking forward to seeing all our listeners there at the conference, teaching some classes, seeing my old friends, attending the Facebook party, the whole event. The American Massage and Chiropractic Conference is an event that I look forward to reconnecting with people at.
Well, no doubt, and I can't wait to see you. Hopefully we'll have more than 5 minutes to say hello as we pass each other running in the halls to wherever we have to be.
Mm-hmm.
And, David, I'm really interested in learning about your new classes, but before we get started on those, I'd like to get your thoughts on the idea of creating community. It's something I've been talking to all the presenters about this year. And the reason for that is that part of the focus at this year's conferences is the idea of creating community by adding a community room where attendees can visit with speakers more personally and learn more about how they can make a real difference at home and in our profession. So, David, I'm just wondering, why do you think it's important to create community in the massage and healing arts world, in our practices or businesses, and at the conference?
Well, here again, this is One Concept stepping out in front and making it happen. You know, they see that there's a need within the profession, and they're helping to heal the profession by delivering what it needs. You know, and part of that is the community and understanding how to work within your community and how to be a successful therapist. And the only way to do that is to really model. You know, all techniques that talk about being success, they say to model. You know, you've got to model success that's already out there. I know initially when I got out of school, it was very hard to find someone that would, you know, my attitude is I would clean your sheets and clean your treatment room, whatever you want. Just let me stand in the corner and watch to learn. So the ability to be able to sit down and visit with people, I would go to conferences and take classes, and just like you were talking, Felicia, you know, what do you have? A few minutes. You may get to speak to the speaker for a few minutes, or you catch them on break, or you've asked a few questions during class, and maybe you schmoozed a little bit at the Facebook party or at the gala dinner or whatever. But in the end, to be able to have a room where you're actually sitting down to, like, just a few more minutes, I mean, it's awesome.
Yeah.
It doesn't sound like much, but it's invaluable, I would pay for that experience, when when I first got out of school, or even to this day, I think, God, if I could have a few minutes of so-and-so's time. So to just be able to be there, communicate one-on-one, and, I understand where people are coming from, because every day I'm making it happen like every other therapist. I'm out there marketing my practice. I'm seeing patients. I'm out there communicating with other healthcare providers. So I understand all the challenges and all the hurdles that we're dealing with in our emotional or physical or spiritual, all the different areas of our professional lives that we've got to deal with. So bottom line, I feel that One Concept, their whole idea, again, of putting these creating community is right on target.
I couldn't agree more, and, I'm just like you. In addition to all the teaching, I have my own practice. In fact, a booming practice that's expanding, before my eyes, something I didn't think I'd do again. And that idea of mentoring and being a mentor and showing people what you can do, what I really feel is when people have a chance to interact with the speakers in a more personal level, the educators, and not just those of us that are teaching at this conference, but the many people that come and attend these conferences, you can start to see that we're just regular people, that we just happen to be driven to serve our community or our trade or our profession. And when you see that, wow, I'm not that different from David Kent, David Kent reminds me of me, or Felicia Brown, and you see that you too have the power. There's something really amazing about that. But sometimes you don't see that when the person is up on stage teaching. You think, oh, I could never be like that. But you have a chance to talk with them one-on-one, and you start to see, aha, I can be that too. And so I think the community room will be a fantastic way for people to get a little flavor or taste of that, and to really connect with people that are involved in the conference.
Exactly.
So, David, let's jump into talking more about your classes, starting with the ABCs of meeting with physicians.
Okay, Felicia, this is like being in the community room, because the reason why this class exists is out of pure necessity. It was necessity for survival. Here I got out of massage school, they told me, people are going to be lining up, for treatments. BS. They were not, and then I was a guy in Rednecksville, Florida. That's not the name of the town, but it's kind of a backcountry town. And, just a bunch of good old boys. And so bottom line, they didn't understand, someone touching them, they didn't know what was going on. But bottom line, I realized real quick that, okay, people go to physicians and they spend money when they're in pain, whether they've got insurance or not. It doesn't matter what their economics are. It's like when they're in pain and things are screwed up, they miss work and they go to a doctor. So I started to realize, okay, and women will, the redneck guys didn't even want their women coming to see me, what the guy touching you, but the women could go see a male gynecologist, and I was thinking, what's that about? So I thought, okay, I'll model doctors, because they've got a good gig going, they're making a good living, looks like they got nice, clean, professional offices, they got staff with them, I kind of like to live like that. And then, too, I realized people paid them. Do you know what I'm saying? And people came to them in very desperate situations. And, I thought, boy, I could really help people, because I had been a patient for so long in bad situations. So to get my practice going, I realized I needed physicians referring to me. And there were only, there's only so many chiropractors in town and so many dentists in town. There are a ton of medical doctors in town, not only in my town, but the town next to me and all the surrounding towns. So I realized, boy, every one of those doctors, or every office, sometimes offices today have more than one doctor. Every doctor's seeing 20, 30, depending on the office, more patients daily. A certain percentage of all those patients have myofascial pain.
Right.
Let me go talk to those doctors and tell them, send me all the patients that are sick and tired of being sick and tired, say they've tried everything, and hand them my card, tell them they're going to have to pay cash. And that really worked for me. Might sound crazy, but But that's my reality. I needed to make a living, and that was one of the ways I figured out how to do it.
Well, David, why is it important? I mean, you've talked about these, having all these doctors and getting referrals, but why do you think it's important for massage therapists and, in fact, chiropractors to learn the specific do's and don'ts of meeting with physicians?
Because there again, you're going to spend your time, energy, and money. You want to spend it in the right way, and you don't want to shoot yourself in the foot. So, right, whether you're a chiropractor or a therapist, you want to market, and you want these referrals from the entire community. You want them from medical doctors, physical therapists, occupational therapists, home health nursing services. I mean, the list goes on and on and on. I mean, every healthcare provider can be educated about myofascial referred pain, from cardiologists to gastroenterologists. I mean, when you really get down to it, but just family practice alone is an amazing area for chiropractors and massage therapists to target into, even acupuncturists as well. So, what you were asking me is what's specific about the do's and don'ts is basically I became an expert by making so many mistakes. I definitely made a ton of mistakes. And so what this class is all about is about the do's and don'ts. How not to put your foot in your mouth, how to stay kind of neutral, what you do when, the rare occasion happens. I mean, in all my years, it's rare, but every once in a while you're going to get a jerk. Every once in one time I had a real jerk, and I even went and had 3 meetings with him just to really understand that he was truly a jerk. It wasn't that I was doing something wrong here. And I even brought other people. We tried different strategies, and also just to get comfortable with answering the questions and how to handle it. I even had one doctor one time walked in and he said, "You have 30 seconds, go." And you know what? He ended up being one of my best referring physicians in the end. So it's just it's like anything else. Once you know what to do, you're okay. It's like if you don't know how to drive and shift a car, you're not going to be able to get it out of the parking space, There's a certain combination of letting the clutch out, putting on the gas, having it in the right gear, and then the car starts to move. And then you back it up and you apply the brakes, and then you go forward. And there's all these things, putting on the turn signal, changing gears, and all that has to happen whether you're driving your car, tying your shoelace, getting dressed in the morning, brushing your teeth. But you also got to get down to the point where you can market to a physician that comfortably. And you can do it just like you can close your eyes and do a massage, or a chiropractor can close their eyes and palpate and manipulate and understand what is going on all types of levels with those patients. So the physician meeting has all those subtleties as well, and that's the do's and don'ts, is how to walk what could be a minefield or can be this beautiful thing that just one physician referring you 1 or 2 patients a week. Trust me, over time, that starts to accumulate, and then those patients are referring you people. Just one physician can really radically change your practice. Radically.
Yeah, so it just sounds like it's really important to pay attention to the details and to have all of your ducks in a row, so to speak, when dealing with physicians. I think that's going to be a really fantastic class for people, particularly those new coming into the field that maybe haven't had any experience, or those that have been unsuccessful in dealing with physicians in the past. I think they'll get some great tips on how to do so with much greater success.
Exactly. Definitely. They'll get all that out of this, class. And even that we're trying to cram it into 1 hour, but they'll be amazed with what they walk away with that they can apply immediately.
Well, that's going to be a really valuable class, and that's a 1 hour, so that's included with the conference pass, with both the general conference pass as well as the one pass.
Mm-hmm.
So I definitely encourage people to stop on that. I do want to move forward and talk about the 3-hour class that you're teaching, because I know this is one of your specialties, breaking the cycle of head, neck, and back pain. I believe you're going to be reviewing the anatomy of the head, neck, and back with un-embalmed dissection footage. I'm not sure if I could stomach that one. But I know you'll also be demonstrating your favorite manual therapy techniques. What else can students expect to take away from that class?
Here again, it almost rolls right with the ABCs of meeting with physicians, because when I go out and meet with physicians, you know what the three biggest things I ask them to refer to me? Head, neck, and back pain. Those are the most three common things I treat. Those are the most three common soft tissue complaints people experience in the United States between the ages of 30 and 60. They're definitely, they're most likely to experience back pain at some point, low back pain at some point in their lifetime. Also, statistically, over 55% of patients are frustrated with their current medical care for their headache treatment. So, and then 80% are frustrated with their back pain. So when you stop and look at those three problems, headaches, head pain, back pain, neck pain, that's what I target, and so that's what I treat most commonly, and that's what I focus on in this class. I'm going to show you different ways to communicate how I assess, how in a minute you can take a look at posture, in a minute you can shoot multiple photos of someone wearing their regular clothes, and trust me, they can see a forward head posture, a high shoulder. You don't need to get super technical for them to see it. It's like when you take, the dentist takes an x-ray and shows you there's a problem on the tooth. They don't explain every detail. They just say, here's a cavity and, we're going to have to do the following. And I show them the challenges with their posture and explain, here's from a soft tissue point of view what we're going to do. Just like the doctor, just like the chiropractor does, massage therapists need to also follow that as well, or even the chiropractor tying in, here's the soft tissue angle that we're applying to your head, neck, and back pain, where we're looking at a total body view, because here again, one concept looks at everything, a whole general view, how we treat the earth, what we're putting into our body, what we're putting into our mind, how we're treating our patients. Same thing, when someone comes into our clinics, whether it's massage or it's chiropractic or it's a chiropractor with massage or however it's mixed with medical doctors, it is important that we're addressing the whole body. And so I'm going to show you tips on how to break really acute pain, because most of my practice has been referred to me from a few different, actually, emergency rooms. So I've had the fortunate experience of working on a lot of very acute injuries and, sometimes days or hours from them leaving an emergency room. So I'm going to be touching on how do we break those cycles, what are some of the psychological barriers that we have with the patients, what are the best manual therapy techniques to get it started to break the cycle, how do we teach the patient to follow through at home with their own self-care that's supporting them, what can we send them home with, as far as educational tools, topical analgesics, again, self-care types of ideas that they can apply to themselves and their family. So that is all being crammed into a 3-hour class. But there again, to break the cycle of head, neck, and back pain, you've got to attack it from a multifaceted, every angle. You've got to hit the entire being, mind, body, and spirit, as we're trying to help people get out of pain.
And David, I wonder, I know why you're so passionate about that in particular, but could you just briefly share your own story with headaches so people understand, that's really how you got into this field and why you specialize in this area. Could you just take a minute?
Right, yeah, definitely. I suffered from very bad headaches. I had so many different diagnoses. At one time in my life, I was on so many medications, it's obnoxious. I can show you Excel sheets of these medications dealing with headaches, blood pressure, breathing problems, inner ear problems. I had been diagnosed with Meniere's disease, scheduled for surgeries. Ultimately, today I'm on no prescription drugs. I have never had, one of those surgeries at all. And really what I'm addressing in these classes is really what I learned as a patient trying to heal myself. That's how I became a body worker. Initially, I only went to massage school because I realized I needed body work, and there was no way I could afford it. My health insurance wasn't covering it, and what I was paying out of pocket, I couldn't afford to continue. And I thought, you know what, I'm just going to go to massage school, learn how to do massage. Then I could train or at least manage a bunch of people so I could get care all the time. Well, that's not how it worked out. In the end, I became, definitely a practicing therapist that still practices to this day. But everything I learned along the way, I applied and healed myself over time. So when a patient is sitting in front of me and they've got a list of 23 or 16 medications and they're going, "You don't understand." I'm like, I think I do, because I can take my highlighter out and highlight almost every one of those drugs and say, I was on these at one point, I am not, and explain to them, here are some things, some parallels that I see between what's going on with them, that's what's going on with me, things that they have not applied based on what they're telling me. Because what I like are the people that are sick and tired of being sick and tired that tell me that they've tried everything, because most people honestly have not. They've only tried a few things over and over, and they haven't tried it all, and it's very easy, but we've got to be taught what to do. That's all. We just have to be shown. And once we are and we get on track, we're all good. It's like training, it's like training our kids, They get out of line. They just need to be shown what's right, And many times we just didn't know what was right because of how we've been trained in our society. Nothing wrong, but that's what the beauty of chiropractic and massage and acupuncture is, how they're just getting us back to the basics and getting us back to being balanced again. And so that's my story, is really, I started with headaches, and it's a long story, but it was my career into body work that healed me, and then I deliver that passion and all those tips into my treatment sessions and into my classes, because to break these cycles, again, you've got to break every part of the pattern, not just one part of it, every part of it. You don't balance 3 of the tires on the car. You balance all 4 of them. You don't have them do a front end alignment on just the left tire in the front. They do both. Or if you've got 4-wheel drive, they do all 4 tires. So when we're treating people, it's more than just myofascial tissues. And then there's more than just that 30, 45, 1 hour, 90-minute session. There's a lot that we need to deliver and teach our people.
Well, and the reason I wanted you to share that, David, one, is because it really helps to illustrate your passion and just how important that is. But I think that a lot of people in our field don't want to tell their own story to their patients or clients. And I do think that that's so important, because when your clients and patients know what you've been through and how the work that you do helped you, it really does make an impact. So thank you for taking time to do that. I want to just finally touch on Student Day. I know you're involved in that, and you're going to be talking about systems for success. Tell me a little bit about that.
Right. Again, one concept, did it again. They're bringing students, they bus them in, they do everything, but they get them there. I mean, hundreds and hundreds, of people, of students in the room. And basically the systems you've got to have systems. It doesn't matter what's going on. It's just like internally we have systems, the digestive system, a vascular system, musculoskeletal system, but they all have to work. Those systems not only have to work individually, but also together so that we're healthy. Well, the same applies to our practice. We have to have all these different systems to market our practice to physicians, systems to communicate to our patients our findings, systems to assess them, to educate them, to document our findings, to let insurance companies or the doctors know our findings, to explain to the patient, here's the plan and here's how we move on. And to do that, you need not only systems, but you need certain tools and you need certain practice. And once you've got it all, it's like anything else. You can drive the car down the street without even thinking about it. You can tie your shoe. And all these over time and with practice, conscious awareness, we have to be conscious of what we're doing. And as we do that, those systems, again, I would have paid an amazing amount of money to be able to sit in a room like that and not only get the tips from people like me. This is like community for students, basically, is how I think of this Student Day. It's community, but for students. And on top of it, they're winning prizes like you can't believe. I mean, hundreds and hundreds of dollars. I give away charts. I mean, they're winning massage chairs, tables, table warmers, sheets, gallons of lotion. I mean, there's a grand prize. It's phenomenal. So if you're a student, I mean, you've made the commitment of time, energy, and money to go to school. I mean, put the icing on the cake, man. Show up, do it, because you got to. If you don't show up, if you don't plan, you're planning to fail. So you got to come up with a plan, and we're going to help make you do it. So I hope people come to Student Day, and here again, it's just part of the wonderful things that One Concept has put together here at the American Massage and Chiropractic Conference.
Well, and with electric, motivated people like you, David, Student Day really has become quite an event. It is a rockin' good time. I know that it is just something that everyone who's involved in it looks forward to every single conference, and students walk away from there with the biggest smiles and excitement with all the goodies that they have received in that program. So thank you for sharing a little bit about that and helping generate some excitement about Student Day and of course, about the other classes you're teaching. Before we wrap up, David, I want to make sure that people know how to get in touch with you and learn about all the great things that you offer in case they're not going to be at the conference or they just can't wait that long. Could you share your contact information?
Yeah, the easiest way to reach me is at my website, www.kenthealth.com, like health insurance, kenthealth.com. You could Google David Kent, and trust me, I'll come up. Please visit the website. I've got plenty of articles and tips and all types of video clips telling you about my classes at the AMC, the ABCs of meeting with physicians, the Breaking the Cycle class, even about Student Day. There's great YouTube clips up there. Also connect with me on Facebook at Kent Health. Again, you could get there through our website. And through our website, you can find our telephone number to reach us directly as well.
Fantastic, David. Well, I know after today's broadcast, everyone listening is ready to come to the conference and, of course, to register for your classes. That's the ABCs of meeting with physicians and breaking the cycle of head, neck, and back pain. And then, of course, Student Day for students only. David will be sharing systems for success. David, thank you so much for taking time to talk with me today and, of course, for being a part of the 2013 American Massage and Chiropractic Conference. And I must add to everybody listening that David will also be presenting in San Diego these same classes, so we're thrilled to have you at the San Diego conference as well.
Well, listen, I'm looking forward to being there. Thank you for having me. Besides the teaching, I've got to remind everyone, if you haven't been there, they've got an awesome Facebook party. I mean, in Canada, we took over to Hard Rock. They had the bands playing. It was a night of dance. I mean, all these parties. I mean, besides education, there's lots of fun. And there's just relationships are created at this event that they're very important to your career. So I definitely want to encourage you to make that step to be there. And I look forward to meeting you there. And I look forward to seeing you, Felicia, at the conference and the whole One Concept team and all our sponsors. Again, I want to say thank you.
Well, thank you, David. And now I want to just switch gears and make sure everybody listening knows how to be a part of this amazing event. The American Massage and Chiropractic Conference is one of the largest exhibitions of massage and chiropractic products, continuing education, and business opportunities for practitioners of both disciplines. This year's conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including David's. Other events during the weekend include the aforementioned Friday night's famous Facebook meet and greet, where the theme this year is disco, and the One Concept Gala that will be happening on Saturday night. The new conference value pass is just $87 and includes access to all 1 hour CE presentations, the trade show, contests, events, community events, and more. And this year, we are also introducing the One Concept Pass, your ticket to full conference access. The One Concept Pass is just $349 and only $299 if you purchase it early. It includes full days with James Wazlowski and Eric Brown, all 3 hour classes, including those with Whitney Lowe, Aaron Mattis, Tina Allen, myself, and all 1 hour presentations. All education is approved by NCB, TMB, and Florida CE Broker, and CEs are included for chiropractors. Also, the One Concept Pass covers lunch each day, as well as access to the trade show, the chance to participate in special events, community opportunities, and contests with literally thousands of dollars in prizes. For students, the conference offers a free student day, as we've been talking about today, and a Smart from the Start program on Friday, May 17th. This is sponsored by Massage Envy, Massage Warehouse Script, BioFreeze, and Bon Vital. This day is dedicated to massage and chiropractic students who are currently enrolled in school or who will graduate in 2013, and includes access to our opening session and trade show on Friday. All of this is happening at the Sheraton Atlanta, and I definitely suggest you make plans to stay there if possible. Single and double rates are just $129 a night, but space is limited, so please make your reservations now. Also, MPA Media is printing the American Massage and Chiropractic Conference event program inside their magazines, Massage Today, Dynamic Chiropractic, and Chiropractic Insights. These will be given out at the conference and distributed throughout the U.S. to over 133,000 practitioners. So if you are a vendor or educator who is listening in today and you want to get some great exposure for your class or product, contact Randy Garrison of MPA Media for details on being a part of the conference program. Now, if you're ready to register for the 2013 American Massage and Chiropractic Conference in Atlanta, and of course to meet David, myself, and the other amazing instructors, just go to oneconcept.com. That's that's ONE concept.com to access the conference schedule and register online. We also invite you to stay connected with us on Facebook at facebook.com/American Massage Conference and /American Chiropractic Conference. Again, the 2013 American Massage and Chiropractic Conference is made possible by all of our wonderful sponsors. Thank you so much to Massage Warehouse Script, MPA Media, the Chiropractic Leadership Alliance, Mindfluence, ABMP, BioFreeze, and Massage Envy Careers. This is Felicia Brown, and on behalf of everyone from the American Massage and Chiropractic Conference and One Concept Radio, I want to thank you for tuning into this edition of the pre-conference broadcast series. We look forward to seeing you in Atlanta in May. Please also consider joining us later this year for the American Massage, Chiropractic, Acupuncture, and Spa Conference in San Diego, California in September, and the Canadian Massage and Chiropractic Conference in October in Niagara Falls, Ontario, Canada. Thanks again for tuning in, and have a fabulous day.